Hi, my name is Riley Martin. I am 24 years old. I am non-binary and I am getting top surgery. A lot of people don't understand why if I'm non-binary then I would want top surgery because it is permanent and is seen as an inherently masculine thing. But I do not identify as a man and have been extremely uncomfortable with my chest from the day that it started growing. I just have memories of it getting harder and harder to shower, and I didn't understand why. I hated bikini shopping. If I could cover up, I did at any time. If I could wear a sports bra, I would. I didn't understand those feelings at the time. It's very obvious to me now what it is. And since I started binding full-time over a year ago, my mental health has drastically improved. So I know that this is something that is right for me. That if I could bind all the time forever and not have any health risks and not have any pain and not have to actually physically wear the garment, then that's what I would want, and that is what top surgery is for me. Being non-binary and getting top surgery for me hasn't been very different. I'm very fortunate to live in a liberal place. I'm in Southern California. My PCP is at a Pride clinic, and there are really good insurance options through the state for me that include HRT and surgeries. And I have never once been pressured to identify myself as a man. I have willingly identified as non-binary transmasculine, which is what I tell medical professionals when I explain what I am, and that is what my official diagnosis is. But my letters from my PCP and my therapist both state that I am non-binary, use they, them pronouns. My surgeon was very well aware that I am non-binary and use they, them pronouns. And I'm not 100% sure what he put on the insurance paperwork to get it to go through, but as far as I've heard, people really haven't had issues with my specific insurance. I know that in other places, certain insurance companies do require that you are on hormones for X amount of time, or that you have been out and living as the gender you are transitioning to for X amount of time. But I luckily did not encounter any of those issues. The only real issues I've had is right when I was starting hormones, I got misgendered once by a phlebotomist, and since then, every person that I talk to has been incredibly respectful, using my pronouns and my name and double checking at every turn to make sure that they're using the correct ones. So I've mentioned insurance a couple of times. That is a big part of the reason why I am still living where I am. It is a county-based insurance, and luckily they are 100% paying for top surgery. Now, to get this approved was kind of like jumping through hoops. With my insurance, you have to make an appointment with your PCP. I had that appointment in late October. I then asked my PCP, who is at the Pride clinic, is very familiar with this situation, for a referral for a top surgeon. Now, at the time that I asked for this referral in October, there was only one surgeon that the insurance would approve. They technically had others listed, but luckily I was at a place that knew what was going on, and they informed me that Dr. Edward Ray at Cedars-Sinai was the only surgeon that at that point in time the insurance would actually approve a consult for, so that is who I went with. So I didn't have the typical experience of researching a ton of people and getting to pick someone out, because honestly, I need to get this done for my mental health. I feel like it's something that is holding me back from life. And if I have to go through revisions, which by the way was mentioned from the start, my PCP mentioned that Dr. Ray was extremely good about revisions and that they would just fight to get them covered by insurance. So that shouldn't hopefully be an issue. So after I got that referral, where I didn't really have many choices, I waited a long time. I had my appointment, like I said, in October with my PCP, and then my consultation was scheduled at the earliest possible date for April 27th. Now, this took a long time because it's just was the only option at the time. My insurance has since opened up other options. They do now also allow you to go to UCLA, so there are a couple of more surgeons. So it really released a lot of the burden on the system, which now allows for faster times and did allow for faster times in the past. I just happened to get this really awkward point in time where they were transitioning to other people and I got caught up in a lot of wait lists. So then I had my consult in April, on April 28th, and the next step after getting my consult was supposed to be that they just immediately submit the prior authorization, they give you a date, and everything is supposed to go smoothly from there. But the current global situation kind of screwed with my situation quite a bit. I was horrified that my consult was going to get canceled like so many other people's did. And I waited forever to call them, and eventually one day I couldn't stand it anymore, and I called them just to see how they were handling the situation, and I am one of the lucky few who got to switch to a video consult. Now, that was definitely not what I was expecting to do. I was expecting to have to drive down to LA and get pictures taken of my chest, get things measured, meet my doctor in person, so instead we ended up essentially Skyping through their web portal. And he just basically interviewed me and asked questions. I had heard from some other people that they were getting their chests like virtually measured. So essentially you would take off your shirt, they would tell you where to measure, and then you would dictate the measurements off to them. I had a tape measure already, but luckily I didn't have to do that. And he just said that he would verify everything when he actually met me in person and make sure that was in fact what I wanted to do. I also asked my surgeon a bunch of questions. I had a list that I wrote out with spots to fill in answers, and I asked him things like, do they give me a post-surgical binder, or will I have to get my own? Are they going to allow me to have any anti-anxiety meds? They said they'd take care of that when I got there. How long before I could drive, swim, work out, stuff like that. There are tons of amazing question lists online. I sort of pick and chose what I wanted from those because I didn't care about things like nipple placement, for example. So you don't necessarily have to ask every single question on those lists. Just ask the ones that are relevant to you. And he answered a ton of my questions when he was explaining the process anyway. So I wasn't left with a ton of things at the end, which is perfect. So things got a bit screwy given the situation here in California in the summer of 2020. The situation that must not be named. To get my surgery covered by insurance, I did need one letter. I had two. So I had my letter from my therapist. I have been seeing her since I started the process of coming out. I intentionally saw her with the purpose of getting a top surgery letter and have continued seeing her because it has helped me so much. My PCP also wrote me a letter. I sent those over to the surgery coordinator immediately after my consultation, and she said that they only required one for my insurance. So the one from my therapist was sent out. Now, if you don't have the same resources I do, if you don't feel that you really need a full-time therapist, if you're scared of therapy, if there's any reason that getting a therapist letter is going to be an issue for you, I definitely urge you to check out the Gallup Project. It is the Gender Affirming Letter Access Project. And so what they do is they get therapists, medical health professionals, psychiatrists, just people who are in fact qualified to write these letters, to pledge with them that they will write X amount of letters a month pro bono to people who need them. They acknowledge that people shouldn't need to be gatekept for these letters, that generally if you're going into surgery, you know what you want, that people don't usually make decisions like this without really understanding that this is something that they need. So it is completely free to see them, and if that person has done their X amount of letters a month, then they try and help put you in contact with other people who can write you the letters in the same program. So it's just a fantastic project. Definitely go check it out. It's at thegallup.com. But because of this situation, I also got fast-tracked. My scheduling was put on hold for about a month. I got them my letter. I did not hear anything back for a really long time. About a month. I am a proactive person when it comes to my transition. I was emailing the surgery coordinator every couple of weeks, like every week or two, just double checking to see if the hospital had updated their policies, seeing if they were adjusting anything, and eventually she did email me back with good news, which is that they were starting to open up for surgeries again, and she would send my prior authorization out to the insurance. Now, what I did not know and what she wouldn't tell me is the time frame that I was looking at. I had no clue if I was looking at a week or 6 months. I didn't expect to be doing it super soon. I thought maybe it would come later in the year. You know, there's a wait list. I'm behind other people. So she sent that prior authorization off. A couple of days later, I called just to make sure it gets there. It takes my insurance 1 to 2 weeks generally to process normal authorizations. They can send it rush, which gets it done within, I think, 4 days. And so I called around the 4-day mark just to check to make sure it had been submitted, because I've had issues with that in the past. And I got the good news that my prior authorization had been approved, that my top surgery was deemed medically necessary by my insurance, and they would be covering all of the costs. I first danced and got really excited, and then I went inside, told my husband, and immediately emailed the surgery coordinator, who responded that she would be in the office the next day, and I could call her then to look for a date. So I started sort of getting loose plans together. You know, the next couple of months I might have to get top surgery, and started sort of gathering resources and looking at more top surgery videos. And the next day I called her around 9 a.m. and she informed me that they had a surgery date for June 8th, which was 12 days out. It was a week and a half out from the day that I was calling her. So I only had a week and a half to prepare for my top surgery. So I am getting double incision for a couple of reasons. Now, double incision, in case you don't know, it's where they make 2 incisions. It's the typical like top surgery scars that you see. There are a couple of other types, but my chest is bigger. I actually measured it before my consult just so I would know a cup size, and I have a size 34D chest. So periareolar, which is where they go around the nip and then sort of drawstring it in, it would not work for me. On top of it, I personally just don't want nipples. I really don't care much for mine. They make me dysphoric. If I really do want nipples aesthetically for some reason, which is the only reason that I would want them, there are fantastic prosthetics from a company called GenderCat that I've already started the process on ordering, and there's such good medical tattooing these days. I've even heard of silicone beads being placed under the skin. I'm not super worried about that aspect of it. On top of it, it does complicate things. You know, that is typical to get nipple grafts. That's okay. But then you do have to worry about if those grafts are going to take. You have to worry about, you know, the different pain levels, the nerves reconnecting, whether you're ever going to get sensation back. You don't know what the firmness of them is going to be, and you can get wildly different results on each side of your chest. So I would rather go into a tattoo parlor in a year and say, here, can you give me this exact color in this exact spot in this exact shape? And so that's what I decided to go with. My surgeon had absolutely no problem with that. As far as he was concerned, it would just be that the recovery is a little bit easier because I don't have to have my nipples bolstered, and that the surgery itself would actually only take 2.5 hours. So I have been now, for the last couple of days, madly preparing, because what I thought was going to happen in months is actually happening in days. So I have scoured every single list on every website, in every Facebook group, for what I should be doing right now with all of this anxious energy. And basically what I did to prepare for my surgery is clean my whole house top to bottom. I'm still a little bit in the process, but almost done. I groomed and washed my dogs, and I have gathered any supplies that I will need post-op. So I have a neck pillow, I have a grabber thingy, I have a sippy cup, I have a pregnancy pillow that is coming, I've got power banks, I've got anything that I might need to stay comfortable, tons of button-down shirts, just basically any cheap thing that I can get my hands on that might make recovery a little bit easier, I've pretty much gathered within the last couple of days. I have also been thinking about what I am going to do when I am pretty much low energy and don't want to do anything, so I've got Netflix watch lists going. I've also been watching a lot of top surgery videos. I had a lot of experience in the hospital earlier this year with my mother, which left me with some pretty interesting feelings about medical facilities in general, and I realized that I just kept picturing myself in that setting, which I didn't think was very helpful or healthy. So I have tried to watch a couple of videos a day, not overwhelming myself, because those videos are pretty intense, of top surgery vlogs, so that I can desensitize myself. I can see other hospital settings. I can sort of break my brain free of all the assumptions that it's making about what my top surgery is going to be like if I see lots of different ones. Oh, I also shaved my head. I did this a couple of weeks ago because I wanted to desensitize my family to what I looked like with a buzz cut, because I knew I would want one when I went into surgery. So I just ended up shaving it, growing it out a little bit, and then shaving it right off all again. Another good piece of advice that I've seen is if you are living on your own or with a roommate, someone who isn't necessarily going to be cooking every single meal for you. I'm lucky. My husband loves to cook. He's totally fine with that. We are still going to get me some freezer meals and stuff so that if I do get caught home alone, I'm not totally helpless. But to make yourself a ton of meals, just make and freeze meals that you would be able to microwave later for a couple of weeks so that you don't end up in a situation where you don't have food or you're constantly having to order takeout. What I still have to do medically before my surgery. Well, on the 2nd, I have a physical with my PCP just to make sure that I am fit for surgery. There are also orders for blood work that need to be done. He will put those in, and I will get my blood drawn the next day at that clinic. I have something called the Get Well loop through my hospital, where they are sending me information at certain times and telling me, like, you know, get laxatives X amount of time beforehand because you're going to need them before surgery. Stop taking aspirin X amount of time beforehand. And they're just checking in with me and sending me emails to let me know what I need to do in general to prepare for surgery. I actually don't have a pre-op appointment. Usually there would have been a pre-op appointment about a week before, but I'm just going to meet my surgeon in the morning, I guess. Especially because I'm sure I want double incision, because I'm not getting nipples. It's not that big of a deal for me. My only things I asked of him were that I have straight incisions and that I don't have dog ears. Those are the two things that I care about, and obviously that I'm flat. I am also supposed to get a nasal swab test for the plague, so I'm going to have to drive down there on the 6th or the 7th because it has to be within 48 hours of my procedure. I think I have to drive down to LA. They said they would call me in the next couple of days and make that appointment for the drive-through test. I am allowed to only have one person come to the hospital with me. It was a possibility that I was going to be alone, and so I'm really lucky that I get to have my husband there. I am also supposed to hear from a pre-op nurse who is going to tell me any other medical information that I need to know or any things that I need to do, medications I need to get filled, anything like that before the surgery. I'm expecting a call from them soon also. So I've definitely got a very suddenly packed schedule here, but it's definitely worth it. Now, do I have any advice for people who are looking to get top surgery? As painful as it is, call, be that annoying patient, be your advocate, be proactive. I think a lot of the issues surrounding transgender care in liberal states come down to the fact that you have to keep on top of things or nobody else is going to. So, like, my prior authorization went through. I was not informed by the surgeon's office. I had to call my insurance to make sure, and then I contacted the surgeon's office. That happened on several other occasions. Just always know when things are going to expire, know when deadlines are. I know it's stressful, but if you are your own advocate and you push for this stuff, people tend to realize that you're serious about it. frankly, they probably don't want to deal with you for much longer, so you might get scheduled a little bit sooner, which I think may have been a little bit of what happened with me. I may have emailed her like 3 times in a month and called a lot before that. But whatever works. I am the only person who really can advocate for me with this sort of stuff. I'm lucky that I have access and the privilege to do so. So if you do, don't take that for granted. I know it's hard. I know it's stressful. But if you can be your own advocate through this, then you will always be informed on what's going on. Do your research. Know who you're talking to. Know why you're calling them. And just be nice. Be very kind to these people. They aren't generally out to get you. If you get on the phone with someone who is unhelpful or who seems to intentionally misgender you, who is just resistant to helping you, and especially if it's at a call center, like my insurance, if you find someone who is unhelpful, go ahead and hang up the phone and call back. You have a lot better odds getting help from somebody else. Also, ask very general questions if it's at a call center. Oftentimes the employees are not actually allowed to give you very specific answers. Like, I can't ask, when is my consult going to be approved? I have to ask, what is the general timeline for a prior authorization like this to be approved? Just be nice, do your research, be your own advocate, and don't give up. Even people whose insurance turns down their surgery, you have the chance to appeal it. Definitely take advantage of that. Fight for your future. Alrighty, so I am going to go probably watch a couple more top surgery videos, probably clean a bit more. I am also going to be doing a top surgery vlog, so if you're interested in that, go ahead and subscribe, or wherever you found me, I'll probably be posting there again when my top surgery vlog is done. I am going to be covering my pre-op, getting to the hospital. I'm going to film as much as they allow me to film. Hopefully a week later when I get my drains out, I can film that. So, I mean, just check back in, and if you are interested in seeing a vlog about a non-binary person who is not getting nipples, definitely stay tuned. Alright, have a lovely day.